Cancer. Outline. Introduction. Goals of nutrition therapy. Nutritional suggestions for symptom management. Methods of nutrition care. Introduction. Worldwide, the most commonly diagnosed cancers are lung, breast, and colorectal cancers, with lung cancer being the primary cancer cause of death. In women residing in developed countries, breast cancer is the most commonly diagnosed cancer, followed by lung, colorectal, and endometrial cancers. Malnutrition is a common problem in cancer patients that results in devastating quality of life, economic, and survival issues. Nutritional care is fundamental to cancer treatment. Davies M. Malnutrition specific to cancer patient populations has been observed to negatively impact patients' response to therapy, increase the incidence of treatment-related side effects, interrupt serial treatment regimens, extend hospital stay, impair muscle function, performance status, immune function, and quality of life and survival. The malnourished cancer patient responds poorly to therapeutic interventions such as chemotherapy, radiotherapy, and surgery, with increased morbidity and mortality compared with well-nourished patients. Goals of nutrition therapy. The goals of nutrition therapy are to accomplish the following: prevent or reverse nutrient deficiencies, help patients better tolerate treatments, maintain strength and energy, minimize nutrition-related side effects and complications, protect immune function, decreasing the risk of infection, aid in recovery and healing, maximize quality of life, improve well-being. Nutritional suggestions for symptom management. Anorexia. Loss of appetite or poor appetite is one of the most common problems that occurs with cancer and its treatment. Table 1. Factors contributing to decreased intake of nutrients. Reduced oral intake. Anorexia. Nausea. Vomiting. Altered perceptions of taste and smell. Effects of cancer treatment surgery. Altered mastication and swallowing. Post-gastrectomy syndromes. Pancreatic insufficiency. Anastomotic stricture. Local effects of tumor. Odynophagia. Dysphagia. Intestinal or gastric obstruction. Early satiety. Malabsorption. Chemotherapy. Nausea. Vomiting. Altered perceptions of taste and smell. Stomatitis. Mucositis. Diarrhea. Psychosocial factors. Depression. Anxiety. Food aversion. Radiation therapy. Odynophagia. Dysphagia. Xerostomia. Mucositis. Strictures. Fistulas. Suggestions for appetite improvement include the following. Plan a daily menu in advance. Eat small, frequent, high-calorie meals every 2 hours. Consume 1/3 of daily protein and calorie requirements at breakfast. Seek foods that appeal to the sense of smell. Nutritional supplements. Substitute poultry, fish, eggs, and cheese for red meat. Add extra protein and calories to food. Suggestions for lessening or alleviating dry mouth include the following. Perform oral hygiene at least 4 times per day after each meal and before bedtime. Brush and rinse dentures after each meal. Keep water handy at all times to moisten the mouth. Avoid rinses containing alcohol. Consume very sweet or tart foods and beverages, which may stimulate saliva. Drink fruit nectar instead of juice. Use a straw to drink liquids. Suggestions for stomatitis include the following. Eat soft foods that are easy to chew and swallow. Avoid foods that irritate the mouth. Cook foods until soft and tender. Cut foods into small pieces. Use a straw to drink liquids. Practice good mouth care. Supplement meals with high-calorie, high-protein drinks. Numb the mouth with ice chips or flavored ice pops. Diarrhea. Radiation, chemotherapy, gastrointestinal surgery, or emotional distress can result in diarrhea. Avoiding hyponatremia, hypokalmia, and dehydration during episodes of diarrhea requires the intake of additional oral fluids and electrolytes. Broth, soups, sports drinks, bananas, and canned fruits may be helpful for the replenishment of electrolytes. Oral glutamine may also help prevent intestinal toxicity from fluorouracil. Limit gas-forming foods and beverages such as soda, cruciferous vegetables, legumes and lentils, and chewing gum. Neutropenia. People with cancer may have a low white blood cell count for a variety of reasons, which include radiation therapy, chemotherapy, or the cancer itself. Patients who have a low white blood cell count are at an increased risk for developing an infection. Suggestions for helping people prevent infections related to neutropenia include the following. Check expiration dates on food before buying or using it. Thaw foods in the refrigerator or microwave. Never thaw foods at room temperature. Cook foods immediately after thawing. Avoid old, moldy, or damaged fruits and vegetables. Avoid tofu in open bins or containers. Cook all meat, poultry, and fish thoroughly. Avoid raw eggs or raw fish. Use caution when eating out. Avoid salad bars and buffets. Limit exposure to large groups of people and people who have infections. Wash hands frequently to prevent the spread of bacteria. Methods of nutrition care. The preferred method of nutrition support is via the oral route. Enteral nutrition is indicated when the gastrointestinal GI tract is functional, but oral intake is insufficient to meet nutritional requirements. Common situations in which enteral nutrition may be needed include malignancies of the head and neck regions, esophagus, and stomach. When the GI tract is dysfunctional, total parenteral nutrition (TPN) is indicated. Parenteral nutrition have been shown to be beneficial in only a small group of patients, specifically post-operative patients who are being aggressively treated and who have demonstrated a positive response rate. Nutritional assessment. Normal to mild malnutrition. Oral feeding. Adequate. Continue oral feeding. Severe malnutrition. Nutritional support. Less than or equal to 4 to 6 weeks. Nasoentral tube feeding. Greater than 4 to 6 weeks. Consider gastrostomy or jejunostomy feeding. Nutritional assessment. Normal to mild malnutrition. Oral feeding. Inadequate. Nutritional support. Less than or equal to 4 to 6 weeks. Nasoentral tube feeding. Greater than 4 to 6 weeks. Consider gastrostomy or jejunostomy feeding.